Among the many psychiatric illnesses that you may harbor in yourself or your family, including psychosis, neurosis, toss in little personality disorders. And these are some things that are underlying, they're hard to change, they're hard to treat, and there can be a whole continuum of something that's just a bit of a trait or morphs into complete abnormality or disorder. So we're going to start with the 10 personality disorders that we typically see in the Sealey family. No, start with number one. Rob, give us a personality disorder.
Number one would be paranoid. This is where you're always under threat from others, so you maybe blame others for things, and you just feel threatened all the time. Paranoid.
Number two is histrionic, and I always think of Scarlett O'Hara from Gone with the Wind, overly dramatic, overly seductive, overly reactive. Histrionic personality disorder.
Schizotypal personality disorder. This is a need for social isolation. You think you have special powers like perhaps ESPN or extrasensory perception. Schizotypal.
Watch the hockey game.
Yes.
If you have a disregard for the rights of others, you don't care about others, how they feel, then you either work for Revenue Canada or you have antisocial personality disorder. That is not an uncommon one, and it can be a whole gamut. It may be that businessman you see that it looks dressed, doesn't look like he's a PD, a personality disorder, antisocial, or it may be a physician, guise of a physician.
Number five, a huge one, borderline personality disorder. These are people with real unstable moods, their irrational behavior, and physicians will tell you these are very difficult people to deal with. They have interpersonal relationship difficulties and very hard to manage.
Yes.
Very hard to manage.
If you have a preoccupation with orderliness, you like to keep everything just right and just perfect, and if you can't relax until things are just perfect, then you may have obsessive compulsive personality disorder. It's different from the disease. It's just a personality disorder, OCD disorder.
Number seven, narcissistic. These people have extreme focus on oneself, maybe centers around wealth or looks or power. Yeah, narcissistic.
I think one of us has those. Any schizoid. If schizoid personality disorder is not, again, schizophrenic, it's close, but it's more of a timidness, an introversion, where you're just very quiet and odd.
Number nine would be a dependent personality disorder. These are people who are psychologically dependent on others for maybe making decisions for them, coming up with ideas of plans. Does that sound okay?
Sounds fine. Number 10 is avoidant personality, somebody who just feels very inadequate, avoids situations that may embarrass them perhaps. Easily embarrassed is avoidant personality disorder.
And number 11 would be a media personality disorder. These are doctors that
place is full of them. Yeah.
appear on TV,
Gordy Tupper.
radio, maybe write books.
Yes. What?